four important structures in this compartment of forearm. Muscles of the back of forearm, terminal branches of radial nerve, vasculature, extensor retinaculum. Surface landmarks. Olecranon process is most prominent bony part on the back of the flexed elbow. The relative positions of the olecranon, medial and lateral epicondyles of the humerus are important. When the elbow is extended, depression present in the posterior lateral aspect of extended elbow. These 3 points form a straight line but an equilateral triangle when the elbow joint is flexed. The hair of the radius can be palpated in a depression formed in the extended position. The rotation of this head can be felt during pronation of arm. The posterior border of ulna is subcutaneous throughout its length. It separates the flexors from the extensors. During pronation, the hair of the ulna forms an elevation over the wrist. The styloid process of the radius can be felt in the upper part of the anatomical snuff box. The dorsal tubercle of the radius, Lister's tubercle, can be felt on the dorsal surface of the lower end of the radius. The heads of the metacarpal forms the knuckles. Muscles of the posterior compartment. These muscles are arranged in 2 layers, superficial and deep. Lateral epicondyle of humerus is the common extensor origin of the superficial muscles. However, there are few exceptions for this, like Anconius brachioradialis. Brachioradialis. Origin. Distal part of lateral supracondylar ridge of the humerus and adjacent intermuscular septum. Insertion. Lateral surface of distal end of the radius above styloid process. Innervation. Radial nerve supplies the muscle before dividing into superficial and deep branches. Action. Accessory flexor of the elbow joint when forearm is mid-pronated. Extensor carpi radialis longus. Origin. Distal part of lateral supracondylar ridge of the humerus and adjacent intermuscular septum. Insertion. Lateral part of dorsal surface of base of second metacarpal. Innervation. Radial nerve supplies the muscle before dividing into superficial and deep branches. Action. Extension of wrist joint. Along with the flexor carpi radialis muscle, it produces abduction of wrist. Extensor carpi radialis brevis. Origin. Common extensor origin and adjacent intermuscular septum. Insertion. Dorsal surface of base of third and sometimes second metacarpal. Innervation. Deep branch of radial nerve, that is posterior interosseous nerve, before penetrating supinator muscle. Action. Extension of wrist joint. Along with the flexor carpi radialis muscle, it produces abduction of wrist. Extensor digitorum. Origin. Common extensor origin. Insertion. 4 tendons are formed for medial 4 digits. These tendons insert via extensor expansion into the dorsal aspects of the bases of the middle and distal phalanges of the index, middle, ring, and little fingers. Innervation. Posterior interosseous nerve. Action. Extends the index, middle, ring, and little fingers. Also produces extension of wrist. Extensor digiti minimi. Origin. Common extensor origin from lateral epicondyle of humerus. Insertion. The tendon passes medial to extensor digitorum tendon of little finger. It attaches to the extensor hood of the little finger and through it inserts into middle and distal phalanges of little finger. Innervation. Posterior interosseous nerve. Action. Extends the little finger. Also helps in extension of wrist. Extensor carpi ulnaris. Origin. Common extensor origin. From an aponeurosis from upper 2/3 of posterior border of ulna. Insertion. Tubercle on the medial side of dorsal surface of base of 5th metacarpal. Innervation. Posterior interosseous nerve. Action. Extension of the wrist. Along with the flexor carpi ulnaris, adducts the wrist. Anconeus. Origin. Posterior surface of lateral epicondyle of humerus. Insertion. Lateral side of olecranon and upper part of posterior surface of ulna. Innervation. Radial nerve C6, C7, C8. Action. Accessory extensor of the elbow joint. Deep layer. The 5 muscles of the deep layer, except supinator, share a common origin, that is, the posterior surfaces of the radius, ulna, and interosseous membrane, and pass into the thumb and fingers. Supinator. Origin. Superficial part, lateral epicondyle of humerus, radial collateral and annular ligament. Deep part, supinator crest of ulna. Insertion. Lateral surface of the radius superior to the anterior oblique line. Innervation. Posterior interosseous nerve. C7, C8. Action. Supination of forearm. Abductor pollicis longus. Origin. Lateral part of posterior surfaces of middle 1/3 of the radius, lateral part of posterior surfaces of ulna and adjacent interosseous membrane. Insertion. Lateral side of the base of the first metacarpal. Innervation. Posterior interosseous nerve C7, C8. Action. Abducts the carpo-metacarpal joint of the thumb. Accessory extensor of the thumb. Extensor pollicis brevis. Origin: posterior surface of the radius below abductor pollicis longus and adjacent interosseous membrane. Insertion: dorsal surface of the base of the proximal phalanx of the thumb. Innervation: posterior interosseous nerve C7, C8. Action: extends the metacarpophalangeal joints of the thumb. Can also extend the carpo-metacarpal joint of the thumb. Extensor pollicis longus. Origin: from lateral part of the middle one-third of posterior surfaces of the ulna and adjoining interosseous membrane. Insertion: dorsal surface of the base of the distal phalanx of the thumb. Innervation: posterior interosseous nerve C7, C8. Action: extends the interphalangeal joint of the thumb. Can also extend the carpo-metacarpal joint of the thumb. Extensor indicis. Origin: posterior surfaces of the ulna below the origin of extensor pollicis longus and adjacent interosseous membrane. Insertion: extensor hood of the index finger. Through it inserts into dorsum of middle and terminal phalanges of index finger. Innervation: posterior interosseous nerve C7, C8. Action: extends the index finger. Posterior interosseous nerve. The nerve of the posterior compartment of the forearm is the posterior interosseous nerve or D branch of radial nerve. D branch of radial nerve arises below the level of lateral epicondyle of humerus. However, some muscles are supplied directly by radial nerve. Radial nerve innervates the anconeus, brachioradialis and extensor carpi radialis longus. The posterior interosseous nerve arises in the cubital fossa as one of the two terminal branches of radial nerve. The posterior interosseous nerve leaves the cubital fossa by winding around the lateral side of neck of radius by piercing the supinator muscle. It emerges from the supinator, passes downwards between the superficial and deep extensor muscles. At the lower border of extensor pollicis brevis, it passes deep to the extensor pollicis longus. It passes up to the wrist and ends by forming a pseudoganglion. Branches. Muscular branches. Before piercing supinator, it gives branches to extensor carpi radialis brevis and supinator. Gives an additional branch to supinator while passing through the muscle. While in the posterior compartment, it supplies extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris and all deep extensors. Articular branches to wrist joint, distal radio-ulnar joint, and carpal joints. Vasculature. The blood supply to the posterior compartment of the forearm occurs predominantly through the branches of the radial, posterior interosseous, and anterior interosseous arteries. Posterior interosseous artery. The posterior interosseous artery originates from the common interosseous artery, branch of the ulnar artery, and passes posteriorly over the proximal margin of the interosseous membrane and into the posterior compartment of the forearm. It contributes a branch the recurrent interosseous artery to the vascular network around the elbow joint. After receiving the anterior interosseous artery, the posterior interosseous artery terminates by joining the dorsal carpal arc of the wrist. Anterior interosseous artery. The anterior interosseous artery, also a branch of common interosseous artery, is situated in the anterior compartment of the forearm. It has numerous perforating branches that passes through the interosseous membrane and supplies the deep muscles. The terminal end of the anterior interosseous artery passes posteriorly through an aperture in the interosseous membrane to join the posterior interosseous artery. Radial artery. The radial artery gives muscular branches to supply the extensor muscles on the radial side of the forearm. Extensor retinaculum. The deep fascia on the back of the wrist is thickened to form the extensor retinaculum, which holds the extensor tendons in place. It is a 2 cm wide oblique band directed downwards and medially. Attached laterally to the sharp anterior border of radius and medially to the styloid process of the ulnar, triquetral, and pisiform. This reticulum sends down septa which are attached to the longitudinal ridges on the posterior surface of the lower end of radius. Thus, 6 compartments are formed in the back of wrist. From lateral to medial side structures passing through each compartment are abductor pollicis longus and extensor pollicis brevis, extensor carpi radialis longus and brevis, extensor pollicis longus, extensor digitorum, extensor indicis, posterior interosseous nerve artery, and anterior interosseous artery, extensor digiti minimi, extensor carpi ulnaris.